All right, welcome everyone. Today we have Nick Lea with us as well. Nick Lea is a global product manager at Condair. He's also the chair of the technical committee 5.11 for humidification equipment for ASHRAE. He will be looking over ASHRAE, how it works as a global entity. And Stephanie Taylor is also with us, and they'll be going over how ASHRAE is approaching the pandemic of the COVID-19 virus. So with that, Nick, if you'd like to turn your camera on and join us for this, and we can start up right away then.
Perfect. Thanks for that introduction, Graham. As Graham mentioned, I'm one of the chairs with the technical committee on ASHRAE, and with a lot of the focus of this segment, talking about the importance of the built environment and the role of indoor environment and the indoor conditions on our health, we thought it'd be useful to talk today a little bit about what ASHRAE is and what ASHRAE as an organization is doing to help combat and provide resources for people working on combating the current pandemic situation. So first of all, what is ASHRAE? ASHRAE is a global society. It's over 100 years old, and it's focused on advancing the human well-being through the built environment. So that means that it's really dedicated to the arts and sciences of buildings, heating, ventilation, air conditioning, as well as all of the other fields that go along with that. And really how this applies to people and occupants is clear right through their vision statement. ASHRAE is really committed to a healthy and sustainable built environment for all people that are occupying buildings. And it's the healthy part that really is being underscored. A lot of the research in past years has really focused on energy. And now that we're getting pretty good at energy, a major shift in thinking is starting to look at really how we can make the buildings better for people. And as you'll see as I go through a few of the different slides here, ASHRAE works in a couple different ways with research and standards as well. ASHRAE is active in two different ways. ASHRAE is active locally through chapter meetings. And really the role of local chapters is to disseminate the research and the technical expertise and the state of the art right down to the people in your local communities that are designing and building these buildings, as well as operating them and maintaining them. And that relies a lot on the global ASHRAE society. And ASHRAE as a global society has four main roles and four main things that they do. The first is that they develop standards and guidelines. And these standards and guidelines ultimately and often find their way into building codes and operation codes and inform the way that people design and operate buildings. ASHRAE also conducts research to grow the base of knowledge on buildings. So whenever there's a topic where we don't have enough information on, ASHRAE will step up and provide either funding or the background for the research to further our knowledge of buildings in the built environment. The results of this research are then passed on to the HVAC community through education. And finally, ASHRAE supports government advocacy efforts to help adopt some of these into the state of the art and the best practices. If you can advance that, please, Greg. So when we drill down inside of ASHRAE, you'll find that there's really four different types of committees that are focusing on the technical side of the buildings. The first is a technical committee, which is the most common and are designed to address a wide range of topics. This is the main type of committee that you find within ASHRAE, and it's the type of committee that I'm currently chair of. My committee is Technical Committee 5.11, and we focus specifically on humidity and humidification equipment. ASHRAE also has the ability to respond to different things going on in the industry and the world through some of the other committees that they have. The first is a task group, which is formed as needed to address a single specific task. There's an improved version of that, the multidisciplinary task group, which brings in people with a wide range of backgrounds. And we'll talk about one of those that's focused on COVID a little bit later on. And as well, ASHRAE has a technical resource group, which provides knowledge in a specific area. Those are a little bit less common. So on my committee, you can see that we have really 4 different ways that we interact and grow the knowledge about humidity and humidification equipment. The first is that we have 4 specific standards, 164 series of standards. And these provide a method of testing the humidification equipment and ensure that there is a consistent approach when manufacturers are putting their products out into the wild. The other and the more important area that we focused on in recent years has been research. And right up until maybe the last 10 years, there hadn't been a whole lot of research on humidity and its role in the health of occupants in a building. We had some information that we knew from the 50s and 60s and research that was summarized in the 80s. Many of you are likely familiar with the Stirling chart, but it really hadn't been updated in a while. And what we were finding is that a lot of the codes and standards were removing humidity from, especially lower limits for relative humidity from the standards. And a lot of that was due to misconceptions and fears about moisture inside of buildings. So we had a research project 1630 in 2016, which established a baseline of knowledge up to 2016, reviewing many different papers. And one of the major outcomes from that was a reaffirmation of the Stirling chart, but also development of recommendations for areas we can research in the future. And we're developing a new research project right now that's focused on a direct intervention study where we can get some more concrete data about how humidity helps people in the built environment. The results of our work are also disseminated to the public in several different ways. But the most common one that we use is programs. So at several different recent winter conferences, we've sponsored programs that help educate people and bring people like Dr. Taylor in front of audiences so that they can pass on their knowledge of humidity and health. And we can try to educate more and more people on that. And we also publish our work in the handbook. In particular, we're responsible for the Systems and Equipment Handbook, Chapter 22, which is due to be updated this year. We've added a lot of really great information on humidity and the latest knowledge in that as well. If you can advance that, please, ma'am. One of the other topics I alluded to earlier was ASHRAE has been busy with the COVID-19 response. And they've set up actually a really great resource page at ashrae.org/COVID-19. And on that website, you'll find a lot of resources and links to the CDC, as well as ASHRAE position statements. But further down that page, about midway, ASHRAE has actually been kind enough to make a lot of the research and a lot of the conference seminars and other educational resources freely available. Previously, a lot of these were behind a paywall and you'd have to pay for them. But I wanted to call out a few in particular. Our section of the handbook is now on that website for free. So there's a lot of great resources there. As well as several of the seminars that we sponsored at recent winter conferences. In particular, one that we did in 2020, putting people first, the healing power of indoor air, as well as a really great one from 2019 that was summarizing the work of our research project 1630. I think both of these actually included Dr. Taylor as a speaker, and I think one of them even as a chair. So if you haven't had a chance to check these out, they're freely available at the web link above. You can advance it. One of the other things that ASHRAE has done is establish a task force and that is specifically looking at epidemics. And Dr. Taylor is actually a member of this, and I think I'll turn it over to her now, maybe to explain a little bit more about what's going on with ASHRAE and their test book.
So hello, everyone. This is Stephanie Taylor. Happy to be here on this Wednesday morning. And as Nick just talked about, ASHRAE has formed an epidemic task force. So this group has about 10 members, 10 voting members, and we meet about 8 hours a week with a lot of behind the scenes work. And again, as Nick discussed, the COVID-19 disease pandemic has really united medicine and engineering. And so, this is real progress for the built environment, because clearly we're indoors most of the time and buildings have the capacity to protect our health. And yet, how do we do that? And how do we do that in particular with this SARS-CoV-2 virus that causes COVID-19? So my role as a physician and also my master's in architecture, my role is to bring to the committee the medical and scientific, like the microbiology data about this disease, and to help explain, what it means when viral RNA is found down the hallway or in exhaust grills. Is that the same as an infectious virus? And how do these scientific, microbiological, and medical research papers inform what we should be doing indoors? So it's really exciting and it's challenging, as you might be able to imagine, bringing together two headstrong groups of professionals. But we need to do that, and we're making really good progress. So in addition to my role of bringing data to inform how to best use building technology to protect us, we're looking at different types of buildings, so offices, schools, hospitals, you name it. And then the different indoor air management strategies, such as Nick talked about, bringing mid-range humidification back, officially back, to protect us, because we know that's very effective against respiratory viral illnesses, but also looking at the interface of filtration and ultraviolet light technologies, room pressurization, room air changes, all of the things that are used in buildings already to different degrees in different buildings. So all of our work and our findings and our ongoing recommendations are going to be released to the public on a special COVID-19 Epidemic Task Force website. We're hoping to have that live on either Sunday or Monday of this coming week. So we're all working hard on our groups, and I think it's going to be very informative to the world, actually. So keep your eye on the ASHRAE website, and if you have any questions or feedback, please let us know. So thanks. I hope to see you Friday.
All right. Thanks, Nick and Stephanie, especially Nick for coming on as a special guest and explaining exactly what ASHRAE, how it works, and what steps they're taking. Don't forget, you can follow Stephanie on LinkedIn. She's posting plenty of new information and articles revolving around how humidification can affect this COVID-19 epidemic for inside our buildings. And remember that we're on a Monday, Wednesday, Friday schedule each day at 10:30. So thanks for joining us, and have a nice day.
Thanks, everyone. Bye.